So when we were talking to the CenturyLink guy, he came out and he goes, "Are you able to get Starlink?" And I was like, "I don't know. Didn't look." But yeah, the CenturyLink engineer was selling against us using them because he's like, "He won't. It's not going to be good." So it worked out.
All right.
So it looks like people are rolling in here, Dave. We'll get everybody a couple seconds to move over from their morning meeting to the fireside chat, then we'll get started.
Awesome.
Lindsay, you could probably put up the next slide, give everybody something to read while we're waiting to get going here. There you go. Hmm. You guys got the sun coming out up north there, Dave, today? Looks like it's
We
happening for
do.
us.
We do. It's
Yeah.
beautiful. Yeah, it's heading off this afternoon to go to a track meet, so I'm sure they will appreciate something that's
Are
not.
you coach track? Is that right?
Yeah, although I'm not. I've stepped down sort of from official role, so I mean, there's still some people I help, but um, yeah, I'm not doing you call it full time, but whatever you call the normal coaching.
Yeah,
Um, so yeah.
good. Yeah, it's hard to not be involved if you're used to being involved. But
Yeah.
all right, well let's get this party started. So, welcome to the May Fireside Chat, everybody. Appreciate having everybody on the call with us today. About once a year, we get a special guest named Dave Chase that joins us for this event, and I've known Dave for a long time now. We've been longtime supporters of Health Rosetta and what their mission is. And each year they're bringing new, innovative, ways of looking at how to continually grow the self-funded, unbundled, and the ways of getting away from the mainstream healthcare monsters. And they've done a phenomenal job. And today, Dave's going to be here talking about Nautilus, and the title of the event, Democratizing Excellence in Healthcare. And so look forward to hearing about this. As always, ask questions as we go. I'll filter those into the discussion. And we've got an hour of great content here. So, Dave, let's do this.
Awesome. Well, thanks again for the opportunity, and definitely look forward to you chiming in at any point, either your own questions or from the folks on. So look forward to that. Yeah, so just a little background. So Health Rosetta, video went off. We're a public benefit corporation. So that means we're a for-profit entity with a social purpose. It's always been our belief that if we can get the success that we're now having, there's an opportunity to establish a completely different set of norms and standards in the industry. And I've been a part of two previous very large industry ecosystem shifts. And ultimately, for that to happen, it has to be a lot bigger than Health Rosetta. Even if we're 100x our wildest dreams, we're not going to be close to 100% of the market. And if we're talking about developing a new industry supply chain, there's things that people now take for granted in other realms, like, you have Venmo. There's a lot of magic kind of happening behind the scenes to ensure that we just kind of trust now, right? That pulling from bank accounts, moving around, well, that stuff doesn't happen by accident. You need to have industry standards and norms. So we created this new entity called Nautilus Health Institute. It's a 501(c)(3). And as the title slide gets at, we're trying to establish new norms. And the only way really to do that is to open source. So we've catalyzed that with about $4 million of investment that we've made in Health Rosetta. And we have this approach where we have this kind of performance lab. There's about 400 employers that we've worked directly with in tandem with Health Rosetta advisors. We prove out these concepts, so I'm going to get into a little more detail in a minute, and battle test that. We're not just ivory tower folks. We're, our Q4 is as hellacious as anybody else in this space. And so that gives us a lot of insights. Of course, we adjust. And then once it's battle tested enough, we make that available to all Health Rosetta advisors. So there's, a few hundred. They collectively are responsible for about 10,000 employers. Further battle testing happens. And then from day one, the idea was, hey, open source what we've now proven works. There's other stuff that are still being worked through, and that's what Nautilus is. So it holds that resource, and we have some incredible people who are contributing to this, that are on the board. People like Marilyn Bartlett and Leah Binder, who's the CEO of Leapfrog. Advisors, contributors, kind of who's who. Chris Deacon, Julie Sleznick, Don Cornelis, who's expert in payment integrity, Rob Archibald, who's actually got a 6 degrees background, that and more. That we found that what we hoped would happen has actually happened and exceeded our best hopes, which is the best people in the industry, the subject matter experts that we've been building these ideas around. They're so busy and they want their work to be more broadly disseminated that they happily essentially pour their intellectual property into this Nautilus initiative, and kind of Health Rosetta is kind of the battle testing place. So from their perspective, they're like, as I mentioned, they want their work to spread. And then they're nice people, but they get barraged, right, by a lot of inbound questions, and they simply can't handle all of the demand. And so they're like, okay, you're saying that if I pour my intellectual property in here, you guys make sense out of it, organize it, and disseminate it. I can just point people to that. Yes, is the answer. And so that's a little bit of the backdrop for this. And so if you can advance the next slide, I'll provide a little more context. And like a lot of industries in their immature phase, it's what you see on the left here is what, basically ports and shipping docks looked like in the 1950s, 1960s. It was a complete cluster. It would take forever to load and unload. And, it's like typically you go ships to trains to trucks. One of the probably 10 greatest inventions in the history of commerce is a standardized shipping container. And these things depicted below in that bottom right, they're called twist locks. They actually hold the shipping container to the ship or the train or the truck. Kind of, and in this world, our health benefits world, using that metaphor, the twist locks are kind of the contracts that hold things together, that spell out what happens, and some what we're going to get into. And so like what happened in, I'll go back to the finance example, right? People used to, barter chickens and use wood nickels, and eventually you had ATMs and other things, right? A lot of stuff had to happen. And so that's what we're working on. So go ahead and advance the next slide. And so if you quantify, and this data is a little old, so I'm sure it's worse. This is just the mid-market employers in the kind of that 50 to 5,000 market. If you look at the slice of what is spent in the mid-market on healthcare, there's the fixed costs. There's definitely some waste there. That's, we can address waste there, but it's kind of the master key that unlocks the claims waste. And certainly folks who are familiar with 6 degrees, about some of that. And there's pieces we can do, but we can go further. And so that's what, if you look at just the piece that we're trying to quantify, you're looking at about $250 billion of waste just in the mid-market. And so that's kind of what we're trying to tackle. And if you go to the next slide, I'll tell you a little bit about our approach. And this is where we have this kind of unfair advantage by virtue of um, seeing across the country, seeing across a lot of the smartest advisors in the country, a lot of the smartest and most proven subject matter experts, what works and importantly, what doesn't work. And what we've seen is this repeatable cycle. You've got to have the right procurement practices and approach it in a certain way. That naturally leads to the best contracting. And then you might have a great contract, whether it's honest mistake or malfeasance, you got to be able to verify it. And if you zoom out what Health Rosetta has tried to accomplish, and when we launched 7.5, almost 8 years ago, I had managed, I joke, I was an archaeologist. I was, digging around for healthcare's Rosetta Stone, who had figured this out and had figured it out and proven it for at least, 5 or 10 years. Because, frankly, I don't really believe anything works in healthcare until it's seen, 5 years. You can kind of get lucky for a few years. And I managed to find about 5 employers or unions that had had success. And we're like, how do we make this much more repeatable? It was amazing what they were doing. It was a necessary step. But if you look at like what a Rosen Hotels is doing, most employers aren't willing to do that level of work. So our objective was to make things much more repeatable. And then, as I say, you're verifiable. And then that's what actually drives plan performance and fiduciary management. That's what we've observed. And then we've tried to sort of organize and codify and replicate and train people on. So, that's really been our approach. And then that's what we're open sourcing that. So if you can advance to the next slide. So just give you some tiny little tactical examples. There is unbelievably abusive norms in the industry and practices. And so I'm just giving you a few examples here just to illustrate what we're doing. You look at data access, hidden fees and revenue, anti-steering, anti-tiering clauses. These are 3 examples of many where the market norms are horrifically bad. And these are sort of a description of how they do that. And then what we've done in Nautilus is, as a collective group in the industry, define what does excellence look like. And so, I have some verbiage there that describes it a little bit of these are the standards. If you want to do what the best do, this is what you want to do. And then if you go to the next slide, it takes it into contract language where one of the things we've done is tried to take qualitative things and quantify them. We've done that with the plan grader. So we now know the 40 most important questions that are predictive of whether a plan will perform well or not, rather than looking in the rearview mirror, what happened with claims. And so we've kind of taken that same approach of take a contract language example. This is kind of a simple concept, but like, how does the ASA define the term claim? Well, there's 4 ways. There's not infinite ways. And so you take these are 4 examples that we've seen, and in our kind of scoring methodology and kind of rules engine, we apply like maybe the first one is a 5 and the second one is a 3 and the third one is a 1 and or maybe 0. And then we can start to, in the case of TPA language, score that rather than do a sort of a qualitative assessment that's pretty non-standardized. We can do that. And then, hey, here's actually model language. So if you go, I'll give some links later, but if you go to Nautilus resources today, we have completely rewritten all of the TPA contract language, as well as all kinds of different tips on how to negotiate in a current context and so on. So that's a little bit of how we break down these problems and these kind of into the atomic units. And then this is just a little example of many that sit within the Nautilus resources. Go to the next slide, please. So,
Hey Dave,
yeah, sure.
before we jump onto that, I mean, there's obviously a lot of work and brain power, intelligence, and resources have gone into this thing. What, when you guys were thinking about how to use it, what drove you guys to make it more of an open resource versus keeping it in-house and proprietary?
Yeah, yeah, no, it's a good question. Really, it comes down to, you know, like the analogy I gave earlier, like whether it's Venmo or ATM, right? There's different standards that dramatically lower the friction on enabling a transaction, and um, and we saw that in spades. I mean, it was a miracle, frankly. Some of these plans that were high performance relative to status quo, but way too much work, right? Just incredible amounts of friction. It really looked like death by a thousand paper cuts, even for the successful ones. And so we're like, hey, if there's going to be a completely new industry supply chain, because if you zoom out, right, that's what we're all doing. It's a, you know, so we didn't get these guys, by tweaking the landline and rotary phone market. You always have to have new industry supply chains. Um, and that's got to be a lot bigger than Health Rosetta, even, the big banks, like Bank of America or, whoever, right? They're a big player, but they're not the entire market. And so, having come out of the technology industry and financial services as our team has, we've seen those things and we've seen the power of like open source software to unseat, these seemingly intractable dominant players like IBM and Microsoft at one point in time. It was open source software that did that. And so that's the type of thing that we're like, we really didn't have a choice. If we didn't, we're not satisfied with this being like a little niche artisanal corner of the industry, which is, honestly what it's been, right? It's probably not even 1% of the market. That's not acceptable. There's too much harm that's being done to people and to our country and pretty much every level of society. Healthcare's dysfunction has really far-reaching implications. So it kind of, I mean, another way to put it, like if you knew the cure for cancer, you would share it, right? Like that's going to save lives. I mean, it sounds pretty dramatic, but the reality is when you have a great health plan, it's great primary care, great, transplant programs, centers of excellence, like it is literally saving thousands of lives in aggregate. And I think if it's doing that, you got to open source it is another way of looking at it.
Excellent. Appreciate it.
Yeah, yeah, definitely. And then the data use part is really important. So it's interesting. Tufts University did an analysis of the plan graders, and one of the uh, sort of research findings was the single most predictive question was of a high performance plan. It was kind of a marker of you had things in order, was you had complete unfettered access to claims data. And so we both have data use as one of the resources, but then there's this thing called METAL. METAL is an acronym for medical ETL. Some people may have heard that ETL, it's extract, transform, load. And I'm sure many of you have experience with how messy data can come in. And you just see some of the problems here. These are probably pretty familiar, right? It can be complex for the plans to get data access, incredible amount of duplicative effort. To do it right, you have to have baked in domain knowledge. Like just being a data scientist isn't enough. And it's just really convoluted. And most people are accepting what we feel are unacceptable levels of sort of data hygiene and clarity. And so what we've done with Metal is about $3 million of software development effort that connects disparate data sources and enables analytics. I mentioned Rob Archibald before. Archibald, he'd been the CTO for 6 Degrees, right? He's worked with a lot of data, right? Obviously, there's a lot of repricing, a lot of great work. 6 Degrees does, and that's given him a lot of experience. And he and we realized that there was a gap at the industry level. And what was happening was, say you're a point solution, maybe you got some, diabetes management program point solution. Well, to verify your thing actually is working, you've got to get clean claims feeds and things like this. And so we saw over and over, if you would want to do it right, you were probably in for a $3 million investment for something that's not differentiating them. It's their, disease specific, condition specific work. Like this is ridiculous, right? Of course, they're going to bake that into their price. So it's another thing that makes things more expensive. And because of the experience that we have, within Health Rosetta, as I mentioned, there's about 400 employers we've worked with. We get complete data feeds. So we're managing millions of claims. And when we got started, it would take, even with 100% fully cooperative TPA, right? I'm not talking some intransigent that's playing games, like somebody who's cooperative. It would typically take us 2 weeks to get that clean data feed working. With the technology, we've got that down to a few hours. And so we've battle tested this. Now we've made it available. You go to the next screen, it goes into a little bit of this is the way things work without metal. There's all these disparate systems for population health management and data quality checks and provider quality. It's just this complete cluster of a lot of different systems, a lot of work. And if people are even doing these things, they're doing it at a high level of overhead versus the next slide depicts what it is we're doing, which is have this open source. So if you can advance to the next slide, please. You have this Metal, this open source tool. So you can get it available. We're in a limited beta, so it's not yet on GitHub, which is for if there's any techie folks, that's where a lot of open source software is held. So it's in a limited beta, but we got 7 companies in production, including ourselves, that are using this day to day and having a lot of success with it. If you have this common kind of data infrastructure, it dramatically lowers the barrier to do the best things to manage risk and population. And so that's really what Metal is about. And go to the next slide. And essentially the way we've structured this is we have the board of directors. I mentioned Marilyn Bartlett and Leah Binder. I'm the other board member, the advisory board, some of these great people like Cora Opsal, 32BJ, just, they've done great with things with their data and pharmacy claims and whatnot. So they're governing the Nautilus Health Institute. Then we have different projects. And so a project might be a TPA field guide, it might be an underwriting thing, and I'll give a few examples in a subsequent slide. And so for each project panel, we have people organizers, kind of project management type people. We have subject matter experts that we're sort of sucking stuff out of their brain, willingly. And then there's people who need to get the word out, right? And so that's what leads to establishing the standards of excellence. What does excellence look like? What are gradations of that? We just did an analysis for a major automaker and their data, and we rated the data quality and what versus what they needed at about a 16%. So they have a long ways to go. And again, we can start to quantify these things that have historically been kind of purely qualitative. So we have these enabling resources. This is what you get when you download the resources off the Nautilus site, and then different ways to drive adoption. We kind of announced we were doing this at Rosetta Fest 2023. We launched it Rosetta Fest 2024, and that's kind of our cadence around we do new drops of updates of existing resources, but new resources. So if you go to the next slide, I think we have a list of some of the active projects. So there's a lot around TPA procurement. That's if you go and look at the publicly available resources today, the TPA field guide gives you a good idea of the level of detail that we pay attention to. It's the core document's about a 65 page document. It then links off to 5 or 10 other like Word, basically documents or spreadsheets that break this down. Again, none of it's rocket science. It's just a lot, right? And you need to be able to break this down. And so you see some of the different things that are ongoing. We're going to have PBM resources coming out at Rosetta Fest at the end of August. We've got data access. I mentioned the data technology that's out there, and then one of the things that's been nice is as we've let people know our sort of thought process. Something happened as an example, the National Alliance of Healthcare Purchaser Coalitions, they have new leadership. Sean Greminger came in and, he's been pretty blunt that they're going to take a more proactive educational stance with their membership, that they've been getting bad guidance, frankly, from their benefits consultants. And you need to, at a minimum, go out to competitive bid. He's like, hey, do you have something that helps employers pick a benefits advisor? Yeah, we did inside of Health Rosetta for probably 5 years. I'm like, we should open source that. And so, we're doing that. And so that's one of the resources. And it's, the first question I get, after I present to employers is like, where do I start? Like, you got to start with the benefit advisor. That's why we started there with our program. Really hard to get the job done. I mean, I wrote this piece in Forbes, before founding Health Rosetta called "This Job Could Save America." I think the benefit most role in the entire U.S. healthcare system. Um, and then you can see some other ones we're scoping. So we have this whole fiduciary management's obviously a big issue. We were very centrally involved with the whole CAA, and our broker compensation disclosure form, which we founded with, is now basically the law of the land, and so on. So you see some things that are underway. So there's a lot to do. We're definitely not done, but we've made some good headway. Heath, did you want to jump in?
Yeah, there's a question that came in from the audience. I think this might be a decent spot to ask it, and then that makes me think of something that I want to ask as well. So I'll start with Byron's question. What are your thoughts about the recent marketing push, the BUCAs of level funding plans for the sub 50 size groups?
Yeah. I mean, it's pretty smart on their part. And I think, if you look at like a United, where, they're a big national player, but a lot of markets, they've got like 5% market share. And so, yeah, I would say scrutinize them like any other thing. Like we're not against anybody. We're for high performance. And so I would put those plans through something like a plan grader that we have, and see how they stack up. If they stack up, great, great. Like if we're going to ultimately have the entire market move, I mentioned IBM, you know, earlier, like they were the most proprietary, dominant, intractable player once upon a time. There's the old line, nobody got fired for hiring IBM. I like to, and you hear it in, our space because, we also have a big blue, big blue cross and blue shield. But I was like, you know what? I was there. Uh, there's a dot, dot, dot on the nobody got fired for hiring IBM until they did. And IBM went from their most profitable year to being on track to lose $16 billion and potentially become like other mainframe mini computer companies that are in the dustbin of history. And, Lou Gerstner is in the pantheon of CEOs who most can't make that pivot. Well, guess what? IBM's got open source religion. They picked that up. And so is there a day? There's no law against the BUCAs having world-class healthcare plans or health benefit plans. They just, most of them, when we score them, get between a 5 and a 17 out of 100. So if they're good, awesome. Let's put them to the test. Let's grade them.
So with that in mind, I think a lot of probably the brokers or CPAs on this call are, the level funded is obviously growing, but there's a lot with, mid-market business. What are things that they could get from Nautilus today that could make the biggest impact? I mean, what would you recommend?
Yeah. Well, ultimately, like this is a collective action problem. Like there's nothing becomes a industry standard without people adopting it. But it doesn't have to be 100% of the market by any means. And I mean, there was actually a TED talk about nonviolent revolutions and basically saying you only need 3.5% of a population to tip a market, or tip a revolution. And so we need that. But in terms of just practical use, um, I'd argue the TPA agreement's probably the most important agreement to get right. And that's why we delivered that first. So, if you go to nautilushealth.org, I'll have a link later too, but pretty easy to remember. You just fill out a little form. It sends you an email with a link to basically a Google Doc. So if you can't open Google Docs at work, do it at home or something, or ask us. But that in turn links off to like four other of these documents. Like I said, the TPA gives you the best idea of the completeness and thoroughness that we apply to this. And I mean, it's hundreds of thousands of dollars of legal work that we invested. We're able to amortize that, right? The way we can make it happen is, we didn't take venture money, private equity money, because that would eventually cause us to lose our way. And it often puts that at risk, right? And so we said, hey, we can amortize that investment across hundreds of employers. Then that $1,100 an hour, lawyer who really knows the nuance of what we're doing is worth paying that. And so you'll see when you go in there, this is the best in the business. And even organizations that have good in-house ERISA counsel, like companies or brokerage firms more likely, they don't see all the edge cases we do. That's actually where a lot of the toughest work is. And so, it was a lot of work for us to make it externally consumable. So we got some grants to make it like it's one thing for us to use it inside of our performance lab. It's quite another when you kind of metaphorically toss it over the fence. So there's good work there, and it's also interesting that we just got a donor that came from the retirement space. She's like, healthcare is defunding retirement, were her words. Um, we know, us retirement advisors know ERISA fiduciary duty. And she, variety of reasons, she's pivoted into this area and saw what we're doing and was like, here's $500,000, go faster. So we definitely need that to, like I said, we kind of bootstrap this, but we can definitely go faster, deeper, broader if we have that. And so, if you have little dollars, big dollars, we'd certainly hope to get that with Nautilus. So, yeah, good question.
Okay.
You can go to the next slide. I think we're just about wrapping up. Yeah, so we will have working sessions. There's going to be a track for Nautilus at Rosetta Fest. There's going to be a lot more coming out. I mentioned the PBM. And, if you want to participate in this is, I will tell you, I've had a fairly long career, not young anymore. There's no work that I am prouder of than what we're doing with Nautilus. There's no work that have more potential than this. This is, really legacy work. I want this new industry supply chain to be available for my great grandchildren and look back at us as good ancestors. I don't think if we left behind what's in place today, I don't think they would say that. And so we need all the support. We put our money where our mouth is. we're adopting this. We will, Health Rosetta will remain the most enthusiastic first adopter of these, but it has to be way bigger than Health Rosetta. So Sean is leading the charge. He's one of the co-founders of Health Rosetta, and so you can reach out to me too, Dave at healthrosetta.org. But this is his slide, and he's really driving it, and he's really got a genius for breaking down really big problems into digestible, actionable chunks. So yeah, that's my wrap up slide. So we can fully go into Q&A if you'd like, Heath.
Yeah, I think through you had mentioned this when you and I were kind of talking about the discussion items, but you guys have tested this thing on hundreds of clients. What were some of the surprises you guys found in that you might not have expected?
Um, just how much of a cluster the data area is and how hard that has been to crack and what the average employer has been willing to accept. And I guess maybe the going up a level, we found in the mid-market that 95% of the employers never, ever looked at any of the contracts that basically allowed the industry to have what amounts to an unlimited corporate credit card to, you know, do private jets and, Ritz-Carlton stays and caviar and Dom Perignon. And so it was shocking. Like they treat it like I treat terms of service on some consumer website. Check, agree. I'm not going to read all that stuff. Maybe that's not smart, but there's lives on the line here. And so that's if you ask me, like, what is the single biggest aha in this whole journey for us? It's the contracts, like this incredibly boring thing. Like I would never have signed up to go to law school. But I become kind of a contract geek, or fanboy or something. Like it is unbelievably important. Every dysfunction that I've managed to sort of unpack and get at the root cause of, none of it's an accident. It's all codified in vendor agreements, like how you're working with a TPA, provider agreements, what's the arrangement between like a hospital and a, network. And those transcend actually all categories of payment, where you're Medicare, Medicaid, employer, ACA. And then the third, is specific to the regulatory environment. So in the employer area, they're called plan documents. And wow, like people have accepted boilerplate terms in the plan documents that are just, you know, not only bad and price, sort of profiteering on the part of folks, but have life and death consequence. And so that's the thing is, man, you got to sweat the details of these contracts.
Yeah. So we've been incredibly fortunate to work with, not only you and Sean at Health Rosetta, but many of your advisors, and also have got some Rosie Awards under our belt. So I know what it's like to work with a Health Rosetta advisor. Um, for those on the call that may not be as familiar, what are some of the advantages that they would see in leveraging a resource like Health Rosetta or Nautilus?
Yeah, yeah. I mean, it's funny. I had a slide the other day that I was like, because we're weird in that we have all kinds of resources that if you're not outside of Health Rosetta, you wouldn't know about. And there's not really a reason for us to have them on a public website. And technology is a big part of that. We actually all come out of tech. I founded what would be considered the most successful tech ecosystem in healthcare ever. Like it's a $30 billion ecosystem. So we're familiar with tech, but it's tech as an enabler. And so I was just putting up this metaphor of like, whether it's, Tom Cruise and Top Gun, or Luke with, with Yoda, or Harry Potter, like there's very powerful tools and technologies, right, that you need training for. And that's why we just don't make the technology available to everybody in the universe. And so that's something that is a big part of our story that people don't know about. They often know about, like, as I mentioned, we eventually open source these things, but the Health Rosetta advisors who we've been working with and the employers that we're working with, they're having a 3, 5 year head start on everybody else. And now sometimes we're working through stuff, right? And like, oh, that's a new novel problem. We need to work through that together. Now, it might be a new problem, but there are very few truly novel problems. And that's where we will tackle a problem with an idea of like, how do you make that available to 100,000 employers? Like that's kind of our mindset, not just, one-off success. And so we really think about scalability, not in the one singular thing becomes massive, but really scale out. And and we talk a lot about the power of community-owned health plans, and how that, yeah, I think it's pretty obvious. We are going through a system collapse right now. It's already happened in rural America. You see what's going on. What's going to replace it, right? This is not going to be in place for millennia. We have to replace it. And so that's what we're all collectively doing. We're kind of glue, that brings some industry players together. And that's ultimately why we opened up Rosetta Fest to everybody in the industry because it is a team sport. We need not only the benefit advisors in our program, but all benefit advisors. We need employers and unions. We need the clinical delivery side. We've always had solutions be a part of it. And, we're super grateful to 6 Degrees from like being there from the get-go. But as you know, like, we're going to Denver this year. We were in Denver in 2022, had 200 plus people. We're probably gonna have 1,200, right? This thing is growing. And we're really excited about that. But we couldn't do that alone. And so that's why we're doing, events like that, Rosetta Fest and the Nautilus Initiative.
With the different categories that you'd listed there with Nautilus, I think you mentioned TPA procurement being probably on the upper end of the importance level, but you had PBM management, fiduciary management, et
Yeah.
cetera. How do you decide what we focus on next? I mean, what's the driving factors there?
Yeah, I mean, it's kind of most broken and broadly applicable. It's like what is the greatest point of leverage? And that's where, certainly advisor procurement, again, that's you got to start there. It's not as big of a resource. And then as you can see, obviously everybody's got medical claims. That's the biggest area of spend. It's kind of the TPA agreement kind of touches everything. But then clearly the PBM arena, right? It's just, I sometimes joke and, with air quotes, it's good news. It's so bad. It's so easy to improve over the status quo. And then if you look at um, the, if you look at the historic ERISA class action suits, like the two unanimous Supreme Court verdicts, on the retirement side, it was about broker compensation. So that was one of the reasons why it was so important from day one to get this right and to move the market norms and now the law of the land. If you look at not that we follow the lead of the class action suits, but you look at like what's solvable there, and what is for these national employers, and they kind of don't have any excuse. The three of the four class action suits that have been filed have been around PBM. And so there's a lot of demand by employers like, oh man, we got to get this right. And you read these complaints and it's not a surprise if you've been following this, but you're seeing they're paying $10,000 for medications that you can get for $300 or $25. And so corporate America is waking up. Now, it's going to be the biggest companies that get sued first. Um, but if you look at the retirement space, there's about 130 suits that are filed every year. class suits, and I'm sure a lot gets settled. So it's definitely reached into the mid-market. So many of us deal with mid-market, these under 5,000 employer um, companies that represent two-thirds of the workforce. Um, and there's a lot of reasons to do it. I mean, I wouldn't say the first reason is to avoid class action suits. But so that's kind of where we prioritize things like that, and where we just see things like where there's catastrophic consequence, like some of the ways that underwriting um, will have gaps in coverage. It doesn't happen that often, in gaps between the plan document and what's in the other agreements. But when it goes wrong, it's catastrophically wrong. So that's the other thing, that we don't want these. We want, whether we're involved in them or not, we want these new type of plans to succeed. When they go catastrophically wrong, that's scorched earth the rest of us have to deal with.
Okay, got a question that came in. Do you see spread pricing on the medical side? If yes, where does it happen most? Hospitals, ASCs, and specialty care.
Definitely hospitals. Interestingly, um, uh, I have a example of that looking in front of me. This is a case that's in California, that's against Cigna and Multiplan. It's pretty extreme, as you'll hear, but also not unusual. So just the high point, hit the high points. I think it was an inpatient psych case. Um, and the hospital billed $996,000. The quote paid amount that went to the provider was $875,000. But guess what happened? Cigna said, oh, actually, there was $11 million billed. And um, they, quote, saved $7 million to get it down to $4 million. And so they retained for their portion $2.5 million in savings, and Multiplan, for their role in this, made $677,000, right? Granted, that's pretty extreme, but and very high claims. But yeah, it's hospitals. I mean, I started my career putting in basically billing systems inside of hospitals. It was a long time ago. But how do you think Epic justifies spending, charging hundreds of millions of dollars to implement a system, even billions of dollars, and charging inside of these large healthcare systems? Um, I guarantee you their sales pitch is how they will improve, and they put it in fancy terms, revenue cycle management, blah, blah, blah. But it is all about Jack in the Bill and gaming everything. I actually did some work in payment integrity, and the hackers, right? Cybercrime experts know that healthcare is the biggest area of cybercrime. Because there's a hack with Target credit cards, all those credit cards go away. They issue new ones, whereas an insurance card is like this evergreen thing. And the hackers just do little system probes. Oh, you know, $15,000 claims, do those get checked? 5,000, 25,000. And so they're quite deft at that. And these things are not an accident, right? I haven't seen a bill over $5,000 or $10,000 come out of a hospital that's not riddled with mistakes. And whether those are intentional or not, they're mistakes. And so the spread pricing, it's horrifically bad. It's good that it's finally getting attention. But it was interesting. That case that I mentioned was the provider was actually suing Cigna over this. It wasn't an employer. So that's actually triggering some of those suits. But it's very, very significant. So you definitely want to pay attention to that. Again, it goes back to that data. If you don't have the data, you can't see those problems. And believe me, I've never seen a business proud of what they're doing, not shower their clients with access to data to show what great work they're doing. If they're saying that it's proprietary or other BS like that, they're obviously, I mean, that should just be a humongous red flag the size of Montana, that they're hiding something. So you got to have access to that claims data, and be able to do something about it, know what to do.
So there's a question that came in around that data. The question came in from Northwest Arkansas with a couple track references in here, but
Yeah.
it's basically about getting that data, the difficulty of it, and whether you've got some strategic suggestions that could help the advisors out there get access to the data.
Yeah, yeah, definitely. If you go in the resources, I'm pretty sure there's a demand letter. And, there have been some people like, I'm sure Scott Haas, he's been one of the OGs of this. And, um, if you send the right letter to the right people and essentially putting them on notice, they're fiduciary if they're not doing this, and you know how to ask the data, who to ask it for, like you can eventually get it. Maybe not for very small plans, but there's in these resources around data use, we have a lot of those kind of tips and tricks, demand letters, and so on. So definitely take advantage of those. And then it's a collective intelligence thing. Like maybe some approaches that worked a year ago aren't working anymore, so that's why we have to do updates to them. But that's our attempt to um, essentially get that collective wisdom of how to do it, because it's not easy. You got to fight. You got to have an employer that's on board with that. But ultimately, if they won't do it, you need to work with different people, and there's usually a choice. And maybe it's not the easiest choice, and there's transition. I get it. None of this work is easy, but the impact is amazingly large and worth it. And so we're just trying to lower that burden for folks.
Excellent. Lindsay, you can kick forward a slide here. Oh, there we are. We're already to that section, but there's Dave's contact information. So for those that are interested in exploring working with Health Rosetta and Nautilus, Sean's information was up there earlier. Dave's information is up here now. And as we kind of get to the back end of this discussion, I'm kind of curious, Dave, what you foresee in the next 5 to 10 years. I mean, where's this going to go?
Yeah, yeah, definitely. For sure, we're going to see organic growth. And, I mentioned community-owned health plans. Healthcare is local, and word of mouth is the most powerful form of marketing. And And of course, word of mouth works better when you can, meet people at the coffee shop or church or the ball game or whatever. And so we're seeing, like one of the community health plans, which was the first one. So it was harder. We hadn't worked out some of the things. We're moving a lot faster now, but we measure things in employee lives, and it went from 38 to 500 to 1300 to 3600. And just in that locale, we're talking in that sort of 3 to 5,000 range. And the work there is now actually spanned where that advisor's supporting tens of thousands of lives outside of their market. And probably would be even more in that locale if he hadn't been pulled away. So we can see that like 38 employees wasn't exactly, Walmart. But the point is you can dip your toe in and get things going. Um, but that time frame you're talking about, and my comment earlier on the system collapse, I do think there is a real possibility, unlike we've seen in our careers, that there is a fundamental reset that happens. And the analogy I've been using is there was a market failure a century ago. with the electrification of America. Like cities were electrified, yet only 4% of rural communities were electrified. And so there was an effort that was, catalyzed at the national level, but very much a local level thing. A century later, still the majority of the land mass of the US is owned by cooperatively owned electric utilities. So it's the customers are the owners basically. That's kind of our theory of change is that we need these community-owned health plans. The first 3 of 6 stages are actually employers operating independent of each other, but on the same chassis, and they're building important foundational capacity there. It's only in steps 4 to 6 that become kind of more integrated across employers and maybe a new legal entity. But I happen to think that a kind of community-owned cooperative utility model gets at a couple structural flaws that we have in our US healthcare system that I'm actually doing some writing on this and I'm going to publish it. But basically, we have messed up 2 things. Um, we have separated the budgets and governance of healthcare, sick care, consuming about 90% of the dollars, but only driving 10 to 20% of health outcomes, with what actually drives 80% of health outcomes. So you look at the places that have better health outcomes, aren't wasting money on avoidable hospitalizations. One area outside of the US I looked at, they measure avoidable hospitalizations. It was 1,100. Now it's 60. Um, and the other thing that's maybe the other side of the same coin is we get the scale of governance wrong. We either have at micro scale a doctor or national or state scale, like too small, too big. What we've observed as I've studied this, the working models, that the right scale is sort of like school, water, fire, congressional district scale, like 25 to 500,000 seems to be about the right scale, big enough, but not too big. So I think there's a distinct possibility that people, wake up to there's no fixing the current system. Like you can make it suck less in some areas, but you have to do a reset. And you can't do a reset unless you redo the health plans. And so that's why we've done that work. And so I think, will the entire country shift over to those? Probably not. But I think where there's been market failures and where there's opportunity, like I've gotten locally involved myself. So we're a national organization, but like, what have I done in the last week? I've gone to a county council meeting and a city council meeting in the public comment. They have 3 minutes, and I'm starting a little education series. And I've got people coming up to me after, like, oh my God, I had no idea that much wealth was getting extracted out of our community. And so it is that grassroots movement that's long-term oriented. That's the only thing that's ever had a chance against a deeply powerful entrenched industry. And that's what we're starting to see. And we're trying to ignite that as well.
Very good. Well, I know that I appreciate all the work you guys are putting out there, so keep it up. Dave, I appreciate it.
Yeah.
For those of you that come back to these each month, June 12th is going to be our next fireside chat. We're going to be talking about selling to high performance health plans. So hopefully you can join us then. Otherwise, Dave, enjoy the rest of your day.
Yeah.
Thank you so
Thank you for
much.
having me.
And we'll see everybody next month. Take care.
All right. Thanks.